Assalamu alaikum, welcome to CaliforniaCare. Today we are going to demonstrate a bit of composite workup on this single tooth. It's an extracted tooth. Somebody has practiced doing endo on it, and there's a post inside as well, and there's some fracture lines. The margin ridges have fractured all, which have been glued back together with some kind of epoxy. Nonetheless, I'll go ahead and give an incisal repair on this tooth, and I'll show you where. We shall try to do an incisal repair right here with incisal edge. I'll do a cross repair of a fracture line or a craze line. Then I'll do a complex or a compounded class 5, in which we will keep the preparation, half of it into the enamel and half of it would cross over to cementum as well. So I can show you how to recreate the CEJ with the bulge on the enamel. A lot of times what I do see is people fix the class 5 right here, but they blend everything into a straight line. So this enamel bulge, which specifically lies superior or coronal to the CEJ, is not replicated and it's not reproduced in the final restoration. Now this curve is right here to also give a little resistance to this, the gingiva, and also it helps the crevicular fluids flow better. Not only that, but when you incise and bite into the food comes down and then slips off into the vestibule instead of sliding down into the sulcus. So anatomically, to recreate this bulge, cervical bulge and then indentation towards the CEJ is very important. So we'll go ahead and repair with composites right here. One of the main objectives of this preparation is also to show you irregular bevels in this dimension as well as in depth. Doing so would help you achieve the chameleon effect of the composite restorative material that you place up on top much better, and the restoration would blend in and it would be more aesthetically appealing, much more blended and smooth restoration. So this is a hypothetical lesion on a tooth, either a breakage or decay, and I've shown you how the internal prep is and how the bevels are. Some people hardly place any bevel, like evident right there. The cable surface is straight at 90 degrees to the cable surface on the outside, and there's zero bevel. Some people put very little bevel all around. Some people put reasonable bevel, which is required 1 to 2 millimeter of bevel. But nonetheless, the bevel normally follows the shape of the cavity or the lesion itself. On the lingual part, a lot of times people come out normally straight and there's no bevel involved. And I think that's where the problem lies, in the sealing of it, the adhesion of it, and then the blending of the restoration. So I'll go ahead and adapt it and show you my kind of beveling, in which you have very good chameleon effect. I've done totally irregular pattern, kind of like sunburst, and to point out few bevel points, but the finger projections are thin, few are very wide. Now depth also varies. Here is very shallow and here is deeper. Here it is deeper, here it is deeper. Same thing right here. Even an access opening on the lingual of an incisor, I have made completely irregular bevels. Now the bevels, like I said, have two components. One is how long the bevel is, and one how deep the bevel is. Keep the depth irregular, keep the length irregular. Make it irregular sun pattern, totally irregular. And then you'll notice once I finish it in composite, one shade composite, this would match that at the same time and it would be nice. Now I'll show you how to fix this craze line or fracture line, then we'll come down to a class 5 restoration. Here I'm going to point out a few things. The inside normally is prepped in the books also, just like if it was for an amalgam or gold restoration. And like I said earlier, majority of the people just go ahead and bring the prep straight out without any bevel. Other people follow the book and give a bevel. Now this kind of bevel, which is purely even throughout with very sharp angle at the cable surface, actually was designed for a gold restoration. Not in gold filling, not to be inlaid by packing gold foil, but a cast gold restoration. A cast gold restoration would suffice here as well, but it was better adapted if you had an even margin and then you burnish the outside. If you were to put a ceramic restoration, a cast restoration, then you wanted these straight angles and you would cement the cast or ceramic restoration, and then you seal the margin with some kind of cement, but the margins would definitely show. And like I said earlier, this was designed for gold. Unfortunately, it followed over in composite resin because earlier on the composite resin was not strong enough to allow for very thin margins, so it had to have some bulk, and that has lingered in the books and in the practice. And that is why when you're doing composite, you can clearly delineate between the tooth structure and the restoration. Now we shall modify this to the way I do it, and that gives me very good blend. So here I'm going to point out how the irregularity is there. Wherever the prep is the deepest, I have made the deep marks inside, and these are the finger projections, and very irregular they go out of the prep. The depth varies. It's not like I have the same depth cutting into enamel all the way through. Here they bevel out to oblivion, completely zero. So this is the kind of prep I'm going to do all around and bevel it off. Okay, so now what we do know is that enamel would take about 20 seconds to etch, dentin would take about 15 seconds to etch, and cementum should not be etched for more than 10 seconds. You're not really etching the cementum as such, except that you're demineralizing it a little bit and allowing for the fibers to show up so your adhesive can get stuck into them like Velcro and give you some level of adhesion or stickiness of the restoration. The way you do it is you apply your etchant onto the enamel first, wait about 5 seconds, apply it to the dentin, wait another 5 seconds and apply it to cementum. Then you can wash them all together. So if you have applied this at 0 seconds, at 15 seconds you apply to this, at 10 seconds you apply to that, now you have waited to 10 seconds, so and you wash it away. So cement was only covered with etchant for 10 seconds, dentin was only covered for 15 seconds, while the enamel was covered for full 20 seconds. Even when you're washing it away, please use a high-speed suction to suction off all of the etchant at the same time. As you blow on it, this might fly and get to the rest of the mouth and cause burning or itching of the soft tissue. So when you're cleaning it up, you suction it off completely and then you wash it away. So by that time you have reduced majority, almost 90-95% of the etchant, and very little bit remains, and then you can wash away the remaining etchant from the tooth and also rinse the mouth at that time. So I'll go ahead and apply it first to the enamel. And with about 5 seconds gap, now I shall apply it to the dentin, taking care not to get into the cementum. I'll wait another 5 seconds or so, and now I shall apply it to the cementum. This is how you can control the amount of time that you are etching each different histological structure. Okay, so when you're applying the adhesive, before you do that, make sure you dry the tooth structure, but don't desiccate it, don't over dry it. You would get better adhesion, and you apply it with a Teflon brush. These brushes are better. The Teflon does not hold the adhesive and it allows the adhesive to flow into wherever you need to apply. Make sure you don't let the adhesive pool into one area, and you apply it all over. Then you lightly dry it with little blow of air, not very heavy, to ensure that the solvent in the adhesive disappears. And I'm rubbing it a little bit to get it into every nook and cranny. And like I said, we're going to do all of it all around, so we can show you multiple restorations on the same tooth. Teflon is what I like, and these are micro brushes, and they allow for easy access to every single location. Once the adhesive has been on, lightly blow across the surface. Not blow into it, not this kind of burst. Very lightly blow across. That would take away the solvent. Once that has happened, then you cure it. About another instrument that I use, if you look at the long shank, it has a double bend right here. Slide bend and another slide bend. Then you have a 90-degree angle. Looking at this instrument, I'm able to get into far reaches of every tooth, and the opposing side has the contra angles built into it. This way, when I'm working on a tooth, here I can do the lingual, and I flip it, I can do the facial with it. So I can do one side, other side, and flip it, and I have lingual on both sides and the facials on both sides. It's a very versatile instrument with double angles, triple angles built into it. 1, 2, 3. 3 angles are built into it in the shaft, and this is very helpful for me. I would not mind sharpening the tip off to get into the grooves, which I'll probably do today, and utilize that for you to get a little better angle instead of blunt. So now here's the final restoration. You see the CEJ is created and there's a definite dip. If you look at it from side, you should be able to see the enamel rises, and it rises evenly all around. We have also rebuilt the incisal edge. The fracture is repaired. The incisal restoration is done. The class 5 is done, compounded class 5, in which we also have cementum involved right there with the CJ rebuilt. And because of the irregular bevels, I cannot tell the difference between where the restoration is and where the tooth structure is. The only fracture line I did not fix was this one. But the distal incisal edge, the incisal edges themselves, and the mesial incisal edge is also rebuilt. And the fracture line that you saw across incisal gingivae has been taken care of with irregular bevels, and we cannot tell the difference. And that is why I recommend doing restorations with irregular bevels. The lingual access for the endo has been filled too with the dentinal shade. And here is actually essentially all one composite built up, one shade, starting from here all the way to the top. On the cementum we used A3.5. The rest is which shade?
A1.
A1 was used for the rest of the tooth. So it really doesn't matter what the natural color is. If you use Solaire, this is the one we have used, and have used this in US and Europe. It is branded under Gradia. It is made in Japan, and in Southeast Asia or East Asia, it is branded as Solaire or Solaire X. And that's 3.5 posterior, and this is for anterior enamel shade, and that is Solaire X is what we used up on top actually. And this is the result you get.